My name is Christina Moros.
And what profession are you in or were in?
So I'm a nurse anesthetist. I'm still a nurse anesthetist, but I'm not practicing. I work full time for the Frontline COVID-19 Critical Care Alliance. Now.
Right. Okay, so let's go back. Where do you want to start the story? During COVID, when you were bored?
Yeah.
Where do you want to start? You just go.
Okay, so my parents were both sick with COVID, and I was living abroad and working in the Netherlands and in the hospital as a nurse anesthetist, although they canceled our elective cases and moved us all to the ICU to take care of the sick COVID patients. So this was back in December, right when all the protocols were and the medications were being found out what works for COVID. And so I encouraged my parents to try ivermectin and the FLCCC protocols, and also America's Frontline doctors also had the same type of protocols. So I encouraged them to go get the medication and to start doing it, but they were scared to do it, to start the medication. So I flew over from the Netherlands to help take care of my parents, but it was a little bit too late because my father went to the hospital to get treatment in the COVID clinic and to get monoclonal antibodies. After having that treatment, he actually got worse, and they checked him into the COVID unit, and my mother was not allowed to go in. They luckily did not take away his phone, but his symptoms got worse. He went from being, he had difficulty breathing, but his oxygen was still stable. But after they gave him the infusion, then his oxygen got worse, and he had to actually be on oxygen in the hospital. He could barely speak, which was not like my father.
Not taking the COVID shot?
No, my parents are not vaccinated. None of us are vaccinated. We wanted him to have the medication in the hospital, but they refused to give it to him. Now, this is my former employee, and I called all of my colleagues to ask to please give my father ivermectin, which he had the prescription for, in the hospital to go ahead and start treatment because he was getting worse. And they said, we don't use that medication in this hospital. And in fact, he'll get remdesivir in the morning. So I was a little bit stressed out about that situation because I knew that remdesivir was toxic. So my mother and I arranged for him to be removed from the hospital to check out with medical leave. And we got him home and we got him oxygen arranged in the house. And my cousin, who's a radiologist, was able to prescribe and get all the other medications that we needed. He already had the ivermectin, but he needed some other things like prednisone and other medications that required a prescription. And so we started treating him at home. And within 24 hours, he was better. He was able to breathe more normally, and after 48 hours, he was off of oxygen. And this was all after 2 doses of ivermectin. At the same time, my mother was also taking the medication, and she was also improving with her symptoms, but she wasn't as sick as my father.
So he did not get any remdesivir then?
No, I got him out in time.
This is the question, how did you get him out? Because 99.9% of the people that sit here cannot get their loved ones out.
Yeah, it was early in the pandemic, and we just checked him right out. And they were not blockading him leaving. I know that story has occurred often because I answered the clinical email lines for the FLCCC, and I've heard that story numerous times. But no, we were able to get him out. You just refuse medical treatment, you sign yourself out, and you can leave.
That's not been the case for many people.
I know.
So you're very, very fortunate. So you actually just proven you saved your dad's life from the stories we've heard.
Yeah.
He did not get remdesivir. You took him home. You gave him ivermectin and some kind of protocol, and he was up and about.
Yeah. Just like the studies show that ivermectin works within 24 hours, he was improved in 24 hours, and he was off of oxygen in 48 hours. And he was in the inflammation stage of the virus, like when people really take a turn for the worse. So we knew it was vitally critical that he get the ivermectin at that point.
So let's talk a little bit about what does work. And this is not giving out medical advice. Everyone watching Children's Health Defence does not do that, and nor does my guest here give out medical advice in this situation. But let's talk about what you've seen, the injuries, and how you've seen people improve.
Well, I can tell you that ivermectin and hydroxychloroquine work. They work well for patients. And also taking vitamin C, zinc, probiotics, all those things, all those elements in those treatment protocols with my organization. Doing nasal spray, like the povidone iodine, when you first get sick, when you first have symptoms, if you start spraying povidone iodine in your nose 3 times a day, that reduces the viral load. So does gargling with mouthwash. So those are simple things that people can do at home. But taking quercetin, vitamin C, vitamin D, making sure your vitamin D levels are up to par, so just not too low. A lot of people walk around with low vitamin D levels and don't know it. If you make sure all those things are available and at home before you get sick, then you can avoid the situation of going to the hospital. So it's actually a good plan to make contact with a provider that can prescribe what you need, because most of this is over the counter, to have in your house, so when you do get sick that you can immediately start treatment with the treatment plan that was prescribed to you from the provider.